Good morning, world. Good morning, beautiful universe. This beautiful planets. We are feeling little emotional, last 50 days, more than 50 days. You are not recovery, still you are healing. It's little difficult. So your disease can hit you anyways, emotionally, physically. The most important part of life is to but your emotional comeback, physical comeback will always done by your doctors. But how can you mentally come back to your situations? Sometimes it's worse, sometimes it's good. After hysterectomy, I felt that I'm feeling good. It's sometimes, and suddenly in a second, I'm feeling so bad. My I know it's about, a doctor already told me it's about my ovaries because this is surgical menopause. Your hormone, estrogen hormone suddenly drop to zero. So this is, so it's take times. So give yourself time. This is necessary to women health. I want to just express about women health. Last 4 years, I'm suffering and I'm dealing with a disease like in our Assam. There are several doctors where I was visited, but the result is zero. Yes, they did the best, some kind of like biopsy or something, but no perfect diagnosed yet they did to me. So I have to choose go outside Assam. So this is very difficult. This is very difficult when you are sad, when you are, you know, this is really very difficult. So life is tough, but you have to make it. Uh, and if you want to make your life beautiful, you have to be patient. You need patience. So I'm making this video for all the ladies who are suffering like me. I was before like 20 years, like 19, 17 years, I'm doing perfectly every exercise, food, diet, everything. But I can't say why this has happened to me, why this is. Um, so you can't ask yourself, this is your body, you have to accept your body. You have to accept your body. This is very simple. So accept your body. If you are sad, if you are sick, then please accept your body. Listen to your body. This is important. And obviously, your mental health is more important than everything else. You have to support your mental well being and mental health. Sometimes after hysterectomy, um, uh, this is totally different experience. You can't express everything with you know sometimes you want to express everything to your doctors, but I don't know how to express and what to express. This is also difficult. the kind of words I'm necessary now, because your 24 hours feelings you can't express in one visit. You have that 15 minutes or half an hour visit, you cannot express your 24-hour feelings, that sometimes you feel good, sometimes you feel very bad, you know. So uh, what to say, if you are anyone who are suffering like me after hysterectomy, because I already told that I have IC problem. This is I can't express what could I say about this disease. This is research. This they are researching about the topic, about the patients, about the medicines, about the trigger, about the flare. So the but the result, nothing. And money, we need lots of money for this treatment, you know. So thank you, YouTube Live. You give me some company to share my feelings, that I'm feeling low, I'm feeling high, I'm feeling extremely something, you know. Uh, I saw lots of IC channels, and I see about industrial cystitis, bladder pain syndrome. Lots of association is there about food, diet, everything I have seen. But I research myself, and I find that uh, I can manage some food. I know sometimes water can trigger me. Sometimes coffee cannot even trigger me. This is so difficult. This is so difficult to discover what is exactly it's happened to us in our bladder. That's irritate our bladder. The acidic food. This is really, and of course the mental stress. It's mental stress. Obviously you are in pain, you are in problem, you are in disease, you are sick. Then mental trauma and mental stress will obviously come, and you cannot avoid this. So it's all about my disease. It's all about I want to discuss about my disease. I was not planned for hysterectomy. Still, I am in shock because I didn't have lots of issues in my uterus like fibroid, tumor, cancer, nothing detect in my uterus. Just there was some little problem like bulky uterus, and of course it's endometriosis. This is the danger disease. This is after biopsy, after remove all tube, ovary and uterus, doctor, the biopsy report, it's endometriosis in my left tube. My ovaries was good, nothing, no problem, but I had removed it. Why? Still, I have a questions why. I diagnose properly. Is I diagnosed properly? My doctor was correct, but or what? This is still I have questions still, because I am a human being. I want to be disease free. I want to free from all the disease. I don't like this painful life. This is not possible. You are ready for somewhere. You want to go somewhere. Suddenly you feel the pain. You can't express. You can't express anyone. Your feelings. Sometimes your family members can understand, sometimes they don't. Because she is fine. After 5 minutes or 2 minutes, she is not fine. This is, this is difficult. And this is the disease I see. You have urine problem. After urine, you have pain. After urine, you have pelvic pain. Time of urine, you have pain. You need take half an hour, 1 hour, more than 1 hour. Need to rest after urine pass. Again, you feel the urine. Same pain you have, and again you feel you have to go to bathroom. Whole the night you can't sleep because of you need to go bathroom. This is difficult. This is really difficult. So मैं पहले ऐसे नहीं थी, पर अब हूँ. And I want to discuss about this disease to everyone. This is so impossible disease. Now I felt that मुझे कुछ बुरा हो जाए. I felt like मुझे ऐसा डिजीज हो जाए जो मैं उसका डायग्नोज कर सकती हूँ. जैसे आई रिमूव माई यूट्रियस बट आई एम नॉट श्योर. मैंने अपना यूट्रियस निकाल लिया, उसके बाद भी मेरा डिजीज क्योर नहीं है. आई एम नॉट सर्टेन. नॉट इवन सर्टेन तो बहुत दूर के बाद. नथिंग. इवन माई डॉक्टर गिव मी sans 20% only sans is pain free. So this is so difficult. And I feel very low sometimes. I feel low. I just want to run from this life. But you can't run. You have to live this life. You have to breathe because I have breathed, you know. And sometimes this 5 years, I ask myself, why me? This is okay, fine. I read all lots of positive books, and it's only helpful sometimes. It's only helpful some minutes, some seconds, when you were reading the book, then you give it hit you. After that, when you close the book, you suddenly forget about, and your all the pain come to you again. Because we are human being, we can't be positive all the time. We can't be positive, and you can't motivate yourself all the time. This is impossible. You can't motivate yourself long time. That's okay. This is fine. This is good. You can't. Sometimes you will be weak. Sometimes you feel very negative, very low. You want to walk. You can't walk. You want to sit. You can't sit. You have to lie down. I don't like to lie down. I don't want to sleep. Even I just want to wake up all the night and want to celebrate life, celebrate, what can I say? If anyone in there, I see patients. I know hysterectomy and uterus removal. This is a very simple, of course, this is a major surgery, but the procedure, I have done robotic surgery. Just the procedure, everything is easy now. We need some 3 months, 4 months, 6 months rest, something. After that, it's for everyone. It's normal life. You need some ASRT treatments, um, uh, like hormone replacement therapy. You need some medicines. Okay, fine. But my case, it's totally different. I have IC. That's why it's mixed. you after surgery you can't even, when my family members and friends comes to me asks about my disease, how can I explain them? I have already cut, I have already this surgery, and this pain already bother me again, my IC pain. I'm confused. Who, and this is really, you know. So this is morning 9:57. If anyone dealing with IC or like, I know I have read lots of article in IC, lots of patients, not only my journey is 5 years, lots of patients I have already seen, they are 20 years, 30 years, they are dealing with IC. I know. So they are encourage me. This video, I think, encourage someone who are mentally exhausted, physically exhausted, like me, you know. So